What is hidradenitis suppurativa? Hidradenitis suppurativa, or HS, is a chronic inflammatory condition that is characterized by painful boils, abscesses, draining sinuses in fold areas of the body. These include areas like under the arms, under the breasts, in the groin, and in the buttock area. It is important to note that HS is an inflammatory condition and not an infectious condition or contagious. We believe it is caused by certain mutations in the hair follicle, which leads to blockage of the hair follicle and accumulation of inflammatory debris inside the hair follicle. HS may present in both men and women, however, it is typically more common in women by a ratio of 3 to 4 to 1. Symptoms usually start presenting in puberty or early adulthood, but can sometimes present even earlier or later. HS is more common in certain ethnic groups, including Black or African Americans. Sometimes the scarring in these patients can also be more cosmetically disfiguring. Many of these patients will experience post-inflammatory hyperpigmentation, which is the darkening of the skin in areas of previous inflammation, as well as keloid or hypertrophic scars. Some of the early warning signs of HS include small, painful bumps in the armpits or in the groin area, and these may be confused for inflamed hair follicles or pimples. Sometimes before a lesion starts, you may feel some burning, tingling, or itching in those areas. HS is often diagnosed clinically. That means we diagnose it based on the signs and symptoms that the patient has. A skin biopsy or blood test is not needed. The diagnosis of HS can often be missed or delayed. In fact, many patients may wait up to 7 to 9 years before an accurate diagnosis is made. This can be due to a variety of reasons. Sometimes the early signs and symptoms of HS may mimic acne or infections. Many doctors might not be familiar with the early signs of HS, and patients may feel embarrassed or ashamed to bring up the topic with their doctor. If you feel like you may have a diagnosis of HS, it is important to seek the care of a Canadian dermatologist who is familiar with the treatment and management of HS. While there is no cure for HS, there are a number of different treatments that can help manage it. Our main goal in treating HS is to prevent the progression of the disease. The treatments include topical or oral antibiotics, hormonal treatments such as birth control or anti-androgen therapy, biologic treatments such as adalimumab or secukinumab. These are injections that help reduce the inflammation in the body. There are also surgical treatments for HS, which include deroofing or excision of the affected tissue. It is important to find a dermatologist that's familiar with the treatment of HS so that they can choose a treatment that is appropriate for you. One of the surgical treatments for HS include deroofing. Surgical treatment is often a necessary aspect of treating HS. No matter how much medicine we give a patient, their boils or abscesses may never go away. So sometimes it is necessary to cut out that affected tissue. A lot of new research is going into treatment of HS and expanding our knowledge in the pathogenesis of HS. This has resulted in a number of new biologics that are currently being investigated to treat other aspects of the immune system, as well as certain oral medications and topical medications. It is important to find a Canadian dermatologist familiar with HS so they can tailor the treatment to you. Sometimes the treatment might be in a stepwise progression, starting with topical treatments or oral treatments, and then progressing on to injections or surgical treatments, or a combination of all of them. Because HS is a chronic condition, it is important to have regular follow-ups with your doctor and also communicate to them what's working for you and what's not. Your input will provide us with information to help choose the right care for you.